Welcome back. And just a quick reminder that you can still submit your questions to our guests using the box at the right of your screen. The pandemic has laid bare deep-seated problems within the U.S. healthcare system. At the same time, it's prompted a number of important innovations, particularly around digital and virtual solutions. Can industry leaders and the new U.S. administration use this crisis as an opportunity to push through vital healthcare reform? We have a high-powered panel lined up to discuss these issues. They are Stephen Corwin, President and CEO of New York Presbyterian Hospital; Ido Schoenberg, Chairman and CEO of Amwell, one of the world's largest telehealth companies; and Dr. Elizabeth Rosenthal, the editor-in-chief of Kaiser Health News and author of An American Sickness: How Healthcare Became Big Business and How You Can Take It Back. Now over to the moderator of this panel, our U.S. Pharma and Biotech correspondent, Hannah Kuchler.
Welcome to this session on US healthcare. The title is It Takes a Crisis, Accelerating US Healthcare Reform and Innovation. So we're going to be talking about how the COVID-19 pandemic has upended the US healthcare system, probably a little bit of discussion about how the system worked in the first place, and how technology is going to accelerate changes. So I've been joined by a wonderful panel today. So we have Stephen Corwin, who is the president and CEO of New York Presbyterian; Elizabeth Rosenthal, who's the editor-in-chief of Kaiser Health News and the author of an indispensable book, An American Sickness: How American Healthcare Became Big Business and How You Can Take It Back. If you don't understand how the system works, I would definitely recommend it. And Ido Schoenberg, who is the co-CEO, co-founder, and a doctor from Amwell, the telemedicine company. So first of all, I'd like to start by asking you when this crisis actually began. Obviously, we know that cases of COVID-19 soared in the spring, but the healthcare system in the US was already facing some really big problems. So Elizabeth, I wondered if you could begin sort of setting the scene for us about what was going on in the system before COVID hit.
Sure, and I think we should first acknowledge that when COVID hit, our hospitals and our doctors and nurses and healthcare providers were truly heroic. I mean, this was a huge challenge. But personally, I want to say we should thank them, but not give them a pass for how bad the system could be before that. It was very, very expensive. It was inefficient. Patients were left with inscrutable bills, inscrutable insurance statements. I had a friend who got breast cancer in France, and when she was diagnosed, she got this elaborate schedule of what she would have to do for her treatment for the next 6 months. I had a head injury myself in April, and it was all on me. It was call this number, call that number, literally hundreds of pages of bills, which even I, as a physician and a journalist, had a hard time decoding what I owed. So, our system has relied on high-priced elective procedures for hospitals to make do. Then Medicare, there's a big debate about whether that pays the right amount, too much, not too much, too little, an adequate amount. Medicaid pays below rates. So our entire system basically depends on overcharging some people to make sure that everyone gets covered. And I think COVID kind of exposed all the weaknesses in our system, and its strengths and its weaknesses. The the wonderful people in it, the incredible equipment and capabilities, but also, we don't prepare for disasters. Who keeps ventilators on stock if really where you're making your money is from elective hip and knee replacements? Why would anyone if you run it as a business? So healthcare run as a business, as it does mostly in the U.S., doesn't take very good care of primary care of people who are or underinsured. I think what we were seeing at Kaiser Health News and when I was at the New York Times, what I was seeing is that has affected everyone now. And what I like to say in my book is unless you're part of the 1%, an interaction with the healthcare system in the United States could lead to financial disaster. And I was thinking that, when I woke up in the emergency room after my head injury, it was like, oh my God, did my husband give them our insurance card? It has continued in that vein where a scan I needed today that I was supposed to get this morning, an expensive scan, is stuck in an elaborate pre-authorization peer-to-peer review, and I will not get it, even though as a physician, I know there is no way I shouldn't get this scan. So that's how I'm going to set it up. And I know there's been wonderful technology that's come in, and I think it has opened the door to all sorts of new innovations. But some of them, I always, when I talk about these things, I always think of two circles. One is what's good for healthcare. The other is what will make money. And where we should focus is where those two circles meet. And often what I see proposed in healthcare has more to do with where we can make money rather than what's good for patients. So I'll start it off that way.
No, that's great scene setting. And I think that if even you can't find your way through the labyrinth of the healthcare insurance system, there's not much hope for the rest of us. Stephen, you run a hospital that was in New York, where which was the epicenter of the first wave, the second worst hit city in the world after Lima, Peru. What were you seeing before COVID hit, and what happened when it began?
Well, I want to first echo what Elizabeth said. I think that we saw the healthcare system at its best and healthcare workers at its best in responding to the crisis. And we also saw a lot of the weaknesses that she talked about. We were very conscious before the pandemic of inequities in care, inequities in access, health disparities with people of color in the U.S. So we had been working our way towards a number of those types of things. What COVID uncovered clearly was a number of substantive issues. The first is hospitals have become just in time, and to a certain extent, hospitals need to reorient themselves to being just in case. Case in point, we had 450 ICU beds before the pandemic. During the height of the pandemic, we were occupying close to 900 ICU beds. We had to create 450 additional ICU beds. Our baseline is going to be 650 ICU beds as opposed to 450, just in case. Same thing with ventilators. And as a nation, we learned that our supply chain was far too fragile for hospitals, and that relying solely to monosource from China probably was a mistake. And a lot of this is to help to drive cost out of the system. And to a certain extent, there needs to be some resiliency in the system when you confront a crisis like this. And then finally, Hannah, what I would say is that if there was any question about health disparities, the survival rate of Black patients with breast cancer, the maternal mortality and morbidity in Black patients, children having poorer outcomes if they're people of color when they undergo surgery, this really accentuated it, and it accentuated it in a major way. So that we collectively as a society not only have to ensure that people get access to care, but we have to look at the social determinants of health. We have to look at that set of intersectionalities. A little bit to Elizabeth's point, hospitals have to start to swim outside their swim lane, hospital systems. And you need this convergence of public health and acute care to have a system that's less fragile than it clearly has been during the course of the pandemic.
Well, there's a lot to talk about there in the rest of our session. I just want to remind the audience, of course, that you can ask questions to our esteemed panelists as well. So please do send them in and I'll try to get to them either in the flow or at the end. So Ida, you have been working to try to persuade hospitals and healthcare providers to adopt telemedicine for many, many years in the US, and some of them finally came around during the pandemic. So tell me about what the technology situation was in the US healthcare system before COVID and what happened when it hit.
Well, Hannah, this did not happen overnight, although it feels as if it did. I mean, the journey to include technology as part of healthcare started decades ago. Amwell is 15-year-old, for example. There were some pioneers that embraced and understood our vision, and Stephen and New York Presbyterian is a clear winner there. We're very proudly working with New York Presbyterian for many years. They are leaders, global leaders in many areas to leverage digital technology to overcome challenges in healthcare. Some of the issues relate to the maturity of the technology. We tend to forget that video conferencing, what we're doing right now, is new, that we had awkward connectivity to laptops, of things of that nature that didn't include a camera or a microphone only a few years ago. And now every grandpa is, like myself, is FaceTiming with the grandkids very, very readily. So we saw enormous maturation of technology. Having said that, until COVID, it was apparent that only few people truly leveraged and benefited from the technology. So to give you an example, not going very far, last year in the United States, only 8% of the population tried telehealth. Saying it less optimistically, 92% did not. This year, with COVID, 22% of the people tried telehealth, which is better, but still not enough. When we talk about providers last year, 22% of the providers tried telehealth. This year, with COVID, 80% of the doctors in America tried telehealth. And over 90% of them said they're going to continue to use digital connectivity and telehealth going forward. That's a sea change. That's very, very important. You asked us earlier about when did the crisis start, and I would argue that a crisis carries crisis always. You treat serious illness and it's a bad situation and people die very often. A crisis is when you're ill-prepared to manage the situation. And clearly in COVID, the healthcare system was ill-prepared to manage this unprecedented demand. I would argue that with technology, if we have a similar crisis going forward, our ability to make it less of a crisis and more of normal care would be much, much better. So one of the silver lining of this awful pandemic is the realization that we cannot wait anymore. We cannot stay in our convenient place. And the actual way that healthcare is rendered need to change. And if we change it, not only will we be better equipped to overcome crises, we'll be able to democratize healthcare. We can bring care like the very high-end care in New York Presbyterian. Imagine bringing that level of care to every village, not only in the United States, but maybe to Africa and maybe to Asia and other places, by taking the clinical innovation and just packaging in a way that is addressable to everyone.
And so, Stephen, how did New York Presbyterian use technology during the crisis, and which parts do you think will stick and what will probably sort of go back to in real life?
Prior to the pandemic, about 3% of our visits were telehealth. During the pandemic, over 90% of our visits were telehealth, because that's the only way that we could provide care. Currently, about 25% of our ambulatory visits are telehealth, and that is increasing day by day. It is a tremendous boon. I'll give you some examples. We don't have more than about 6,000 or 7,000 child and adolescent psychiatrists in the country. If you do telepsychiatry, you can leverage an individual child and adolescent psychiatrist, and we do that in all of our school-based clinics. So that it's a major advance. You don't need to come into the doctor for a post-operative surgical visit. It can be a 5-minute televisit. You don't need to necessarily to have every mole looked at by a dermatologist. They can look at it through a telehealth visit. So you can incorporate this technology into the normal workflow of physicians. And our physicians love using it. They've gotten used to using it. They love using it. It connects to our electronic record and so on. Now, where are the challenges? Well, last mile broadband is a challenge. And that's equally a challenge in urban underserved areas. New York City Housing Authority does not have broadband. In addition to that, in underserved communities, you can have a literacy problem. You can have a language problem. So we need to make sure that telehealth, the promises of telehealth, reduce disparities as opposed to increase disparities. And that is what we are working on now at this very minute. So we provide telehealth services to all of our patients who are underinsured or uninsured, but it's challenging in terms of identifying a spot where they can get Wi-Fi. This is why something like 5G, if it comes about, could be a real boon. So I do think we're in a stage of evolution. I think telehealth is a major advance and can democratize healthcare to a great extent.
Elizabeth,
Yes.
how do you see
Probably
technology? Where is it going to be helpful and where is it not going to solve those problems?
Right. I'm going to push back a teeny bit because I have benefited tremendously from telehealth. And you're getting 3 people from the same. I trained at New York Presbyterian, so it is my hospital system when I'm in New York, but I'm in DC now. I think the thing is we have to define what is telehealth and when it should be billed for and how much it should be billed for and when it's appropriate. And my great fear is that the promise will be lost in its misuse for the business part and not for the patient part. So I'm just going to express my fears in the hopes that it won't happen. You know, why did telehealth explode during COVID? Partly because people couldn't go into the hospital. Yes, that was the major reason. But the other reason was that insurers agreed to reimburse it as if it were an in-person visit. That wasn't true before. So will that hold? I'm not sure. And if hospitals aren't getting as much money for telehealth, will they still be so enthusiastic about it in general? I'm not talking about New York Presbyterian, but, you know, part of
it's a very, very valid point. And what we've done is basically said, I don't think most telehealth visits should be reimbursed the same way that an inpatient visit is reimbursed. Because I think that it is, at least at this point, not the level that is required oftentimes for an in-person visit. Some of them are, but some of them are not. So there needs to be a reckoning of that. But we've said to our physicians that from our standpoint, it is essential to put it into the workflow of the physicians, and that from the physician's standpoint, the hospital will bear the expense of providing the telehealth services so that the physicians have no incentive or disincentive to provide it, so that it is provided when necessary as opposed to because it pays more or it doesn't pay as much, therefore I'm going to bring somebody in for an in-person visit. So I think you're right. Any system can be gamed. And what we want to do is incentivize behaviors that protect the public interest and the public good.
Exactly. Like it's the classic problem with healthcare. It's often not about the system. It's about how it's used. If it's used for the good, it will do good. And if it's used just to make money, it will do just that. So I think the things we have to look at is First of all, many hospitals are bricks and mortar, right? Telehealth allows you to do a lot of stuff out of the hospital, which is really valuable. What are you going to do? I mean, hospitals have traditionally made money by filling those bricks and mortar beds. We probably need far fewer of those if we're going to invest in telehealth. And that's going to take a lot of convincing of some hospitals that have just put, I go around the country a lot, and, I go to a hospital system and they show me their brand new 600-bed building. And I'm like, that's great. Are you going to turn it into condos when all those people can be taken care of at home or as an outpatient? So I think we have to redirect that entire investment stream, which is going to be a battle to kind of take things that are brick and mortar now that often have bank loans and bonds sustaining them. And, you can monitor a cardiac patient at home. I've heard from someone at a hospital, I say that to my department chairman and they go, oh, no, don't do that. We need that bed filled. So it's going to be how we pay for these things. And then lastly, I think it's, will we use them appropriately? Meaning some things, and I've learned this as a patient so far this year, some things you can't just do and I had to do a lot by telehealth after my head injury, which meant that for the first 2 months, no one could check my reflexes, right? Because you can't do that by telehealth. I had some great physical therapy sessions by telehealth, but they couldn't quite tell which muscles weren't working properly. I'm much better now. So it was all wonderful. And I'm really grateful. It was through the Hopkins system. They were fabulous. But I think, it taught me a lot and got me thinking a lot about when is telehealth, and I'm sure my colleagues here have thought about this a lot. When is it useful? And when is it really better to get someone in, even though it may be more of a hassle for the patient and the doctor? And I worry that there may be, my kids, my 20-somethings are all like, oh, I just did a telehealth visit. And I'm like, okay, you got antibiotics because they couldn't really look at your ear, right, to know whether you had an ear infection or not. Or I was just billed $250 to be told to renew a prescription because it was a telehealth visit. I'm like, that's what happens when you call your doctor. That's not a telehealth visit. So there's plenty of room for gaming. It's a vast new opportunity that's out there, and we just have to make sure we do it right, I think. And that's the challenge for my colleagues on the panel. I'm just the kind of observer.
We're getting a couple of questions in from the audience about telehealth, and I wonder if, Ido, you want to attempt to answer them.
Can I just answer Elizabeth before we do that? Because she said some really important things that I think deserve a reply. And I'll do it really quickly. Elizabeth, I couldn't agree with you more that people say telehealth and mean different things. Yeah. And that's incredibly confusing, and we should maybe organize it a little bit. Because for the past decade or so, telehealth was a call center in the cloud that replaces your doctor. I couldn't find my doctor. I call online. Usually I know what I have. I have a very simple situation. So it's urgent care, or in some cases, behavioral health, or in other cases, dedicated point-to-point telemedicine for stroke or things of that nature. That's pretty much the thing that it was. And we all know that when I talk to someone I never met that has no background, for one and done visit that is not recurring, that's very far from ideal. And I'm being very kind right now, okay? None of us actually wish it for our family. We would much rather go to the doctor that we know and trust, that knows our record and so on and so forth. But until the past few years, when you said telehealth, that was telehealth. And it was cheap, and it served the purpose. It increases productivity for employers. It was more economic for payers. And in many ways, it threatened the opportunity to use technology the right way. And then telehealth also became video conferencing. Really solved one problem, which is distance. I cannot be with my patient in the same room. I have my same EMR. Now I'm ready to talk to my patient who is not in the room. I'm pressing a button and the patient is far away, sometime in a presenting location and sometime at home, and I'm talking to my patient. That is good, but it solves a very narrow problem, which is distance. Here is what I think telehealth is and what it should be. Telehealth is an opportunity to completely rethink how healthcare is rendered from scratch. And what do I mean by that? Item number one, data collection. It's pretty amazing that in 2020, we managed diabetes by asking our patient to come to the lab every 3 or 6 months to measure hemoglobin A1C. We need to be monitoring this patient continuously all the time, and we can in different ways. So when you think about telehealth, item number one is to collect much more information continuously so we can react much faster in a more sensible way. In order to do that, because there is so much information, you need to invest in analytics. You really need to understand gaps in care. You need to understand the health of populations and raise the right flags. Because of that capability, you need to rethink care plans. The old care plans don't work. You have much more data, you can react much more faster. So the smart people in Neuropresbyterian, in Cleveland Clinic, in Intermountain, in many other places, in Kaiser, should think, and I know they are, about how do we rethink patient care and remote patient care, leveraging technology, but without diluting quality. It doesn't need to be the cheap alternative to care. It's high quality care done differently, powered by technology. And then you have an opportunity to engage with patients and providers in a way that is sensitive and transparent to payers, because all this would not work unless we find a way to find it. Whether the funding is too high or too low, we can always argue, but there is no question that that should be funded because it does improve financial and clinical outcomes, which is why we're here, all of us. And there is a great opportunity then to close the loop with an effective intervention. This is telehealth. It takes a village. Everybody needs to contribute, but that's going back to what Steve said, democratize healthcare. That type of telehealth is high quality telehealth that will bring healthcare to every home.
That is a good, big new vision for what telehealth can be. I'm going to skip the telehealth questions from other people because we have a lot of other stuff to get through on this panel, because of course, as much as COVID-19 has dominated our thinking, we also have had an election in the last couple of weeks. And a lot of the questions coming in from the audience are about that election and what that means for healthcare in the US. So I'm going to ask Elizabeth first, and I'm going to put a couple of them together and see if she can answer them. It says, will Obamacare be rescued by Biden? And another one is, will accountable care grow in the Biden era?
I think we got a good sense from the Supreme Court that the Obamacare or the Affordable Care Act will persist. No one ever thought that was the final answer. We still have really high prices, even with Obamacare. The premiums are unaffordable for many patients. So there are a lot, and there's just tons of problems still to fix, but I think most of us feel good that we have that still as a starting place rather than going back to, kind of the very, very beginning. What President-elect Biden, I presume, will be able to do will depend largely on what happens in the Senate, and how the senators are divided over this. I think we are headed towards some kind of big change in how we price prescription drugs, because before COVID, there were bipartisan bills. There was a lot of momentum. We were all kind of shocked that nothing got through because it's for Kaiser Family Foundation. We see so much pain out there around that issue. Also, probably surprise billing. I would expect Congress to take on. For those of you who don't know the U.S. healthcare system, you can suddenly have a bill from someone not in your insurance network that's tens of thousands of dollars, and you are just stuck. Everyone knows it's wrong, but no one has been able to solve that. But beyond that, I think there will be changes slowly in hospital payment. There's a lot of players at the table, a lot of lobbyists. When I moderate panels, I always say it's like a circular firing squad. You know, everyone thinks the money that it's the other guy's fault, and it's a system fault. So I do think it's a good starting place, and he's going to have to do a lot more, particularly with drug prices, pretty quickly.
Yeah. Stephen, what do you think the election means for healthcare? And I'll also add on one question from the audience. Given that you've just launched this Center for Health Equity at New York Presbyterian, someone in the audience asks, how will the exposed inequities, I presume by COVID, drive an increased role for ICER in price setting for Medicare or private payers? And just so everyone knows, ICER is the body, it's an independent body that tries to analyze what a fair price is for a drug. Unlike in some countries in Europe where that's part of the government system, it's actually just advisory, but people are paying more attention to it. Stephen.
Well, I think Elizabeth summarized it well. I think there's little likelihood or appetite at this point for Medicare for all. Even if the Senate was 50-50, the conservative Democratic senators will not go for it. So with a Democratic Senate, I think expansion of Obamacare could happen, public option could happen. But I'm not hopeful about that. I think the likelihood of a Democratic Senate is slimmer rather than possible. He can do a lot with executive orders, and I think he will. I do think there is bipartisan support for pricing transparency. I do think there will be bipartisan support for surprise medical billing, and that's got to go through. And I think there's bipartisan support on drug pricing. So I think that's got those things have a chance. In terms of expansion, so that we get universal coverage, I still think that's not in the cards, at least in the short run, and we have to get to universal coverage. In terms of the health inequities, I think this is a field that has been littered with good intentions, but not a lot has happened. And so part of the things we have to make happen are to be a national advocate, and we have to show that we can reduce health disparities. Now, one of the issues that we have in the U.S. is even with the advanced electronic records, about 50% of patients do not self-identify. And part of that is because of fear, the history of being experimented upon if you're in an underserved population, particularly Black Americans or Latinx Americans. So the first thing you have to do is have everybody self-identify so you actually know what your outcomes are. Second thing, of course, is that once you know those outcomes, you also have to get people to open up and talk about the social determinants of health, whether it's literacy, whether it's food insecurity, whether it's housing insecurity. Those are important things to uncover. And then finally, you have to act. I'll give you a perfect example. In advanced care, the calculation for how one clears the body with kidney function is called the GFR, or the creatinine clearance. That algorithm is biased against patients of color, which is why less Black patients receive kidney transplants than white patients. The algorithm for listing somebody for a heart transplant is skewed against Black Americans. So the number of Black Americans that have been transplanted in the U.S. has fallen by 20% over the last few years. I can go on and on in terms of these disparities. This is what we have to correct and adjust for. In terms of pricing, Elizabeth hit the nail on the head early on. The reality is that Medicare and Medicaid underpay, commercial insurance overpays, and that combination sort of makes the system sort of work. And so part of the problems with underpayment in Medicaid or being uninsured is the lack of ability to get excellent primary care, the lack of ability to get preventive care, and so on, which adds to the burden of chronic disease of underserved populations. So So we have to address that. And then we have to address the economics of the system as a whole so that it's not as rickety as has been described.
And can I say, I think it almost goes deeper than that. I think one thing COVID revealed is that we really have hollowed out our public health infrastructure terribly. Many states, we're all in states that have expanded Medicaid. Many states still haven't, leaving many people without insurance. I think this notion of, letting people charge what they want to insured people in the hopes that that will somehow get care to uninsured or poor people, it's just, it makes no sense. It really doesn't. So we really need, to me, a kind of baseline health insurance. Not everyone needs a Cadillac plan, but everyone needs some kind of protection. And during the Trump years, we've gone in the wrong direction in that.
Well, the other point that I would make on that, Hannah, is that that it should not be a choice between public health infrastructure and acute care infrastructure. It's got to be a combination. There's got to be a virtuous combination, and we've seen that. You saw a hollowing out of the Office of Science and Technology. You saw a hollowing out of the CDC. The CDC was late to the game in terms of testing. That put us back by a good 6 weeks, and that was a major problem. Pulling out from the WHO is not going to solve the problem. So we need to rethink our public health infrastructure, which is a patchwork quilt, state by state. There needs to be a strengthening of the federal response, and there needs to be a reimagining of the public health infrastructure, because the next pandemic won't be the same, but there will be a next pandemic. Woe is us if we don't take the lessons of this one and develop a lot more resiliency and a lot more reserve. We still do not.
How likely do you think that is to happen?
I know for a fact that the CDC will be strengthened. There is no question about that. All the Biden people we've talked to, that they will do that. There will be somebody in the national security apparatus who deals with pandemics. That was taken away during the Trump administration. I think that there are a number of things that will be strengthened. Can you strengthen the patchwork quilt of the states? We can't even get everyone to wear masks. So that's going to be an uphill battle. But if you are an optimist, I think people understand that the public good outweighs the libertarian impulse to say you can do whatever you want. Unfortunately, we had a president in President Trump who had his Evita moment on the stairs of the White House, which didn't help things at all.
Elizabeth?
Yeah, I have to be a little bit of a bad guy here, though, because I think, to me, one of the problems was that we see this as a public health system and hospital systems, which are largely private or state. Even the state-run ones are separate from the government takes care of public health. And I always like to point out, and I know this is always uncomfortable and there's lots of debate, that most of our hospitals are not-for-profit institutions who do not pay a lot of taxes because we count on them to provide a degree of charity care and community benefit. And I think I'm glad to hear of the programs coming up now, but I think most of them have been pretty measly. Like, they don't do, you see Hopkins, the hospital I go to in the middle of a community with great need. We did a wonderful story a few years ago about how much money they got for research on asthma and how many admissions for asthma there were from the 5 zip codes around Hopkins because these kids weren't getting preventive care. The housing was bad. So I do think we need a more seamless system, not public health out there and acute care here.
One of the audience questions is there a model in the world that might be a model for the US? I'm wondering whether they're coming from a point of view that they want the US to adopt their system or not.
Well, that's Elizabeth's wheelhouse. She can talk to you about what she thinks the right system is. I would say that it is very important that a not-for-profit hospital demonstrate community benefit and demonstrate that they're interested in the public good. My health system, 33% of the patients are Medicaid, 50% of the children are Medicaid, 50% of the psychiatric patients are Medicaid, and our community footprint in Brooklyn, in Queens, in Northern Manhattan is quite large. So I don't know what Hopkins does or doesn't do, but I think that's fundamental, and I couldn't agree with Elizabeth more. My personal view is you need some form of private-public partnership, and there needs to be the ability to universally cover everybody. We can get there via different ways, but I think the notion that we could get in one step to a national health system type of system is probably not going to happen. I think there needs to be a combination of insurance and government insurance in order to be able to float the boat. That's my own view.
And me, I always say when people, I'm always put on the spot on this, and I'm a journalist still, so I have, and I actually don't have one opinion on this. I think the U.S. will find a system that feels appropriate for its values, its patients, its financial realities, its political realities. I think we can learn good lessons from a lot of health systems, and we should piece together something of our own. I think the problem now is it is a patchwork, it is a business with not a lot of vision of what a system should look like that's appropriate to us, with no good way to think, no ICER, no good way to think about what we should be paying for things or how we can encourage care for low-income people. It's a non-system now, and that's not okay.
Yeah, a non-system. I agree. So obviously one element, we tried to cover a lot of ground in this discussion, but one element that we haven't really got to is how, COVID has led to perhaps the neglect of some chronic conditions, that is highlighted how some chronic conditions can be, make you much more vulnerable for infectious diseases. And of course, it's also shown that there's going to be even larger mental health burden on the system. So I wanted to go and ask Ido to answer this last question from an audience member. He said, this is a once-in-a-lifetime opportunity to trial, test, and implement telehealth. What about patients' education for preventative medicine using digital services? Can this play an important role?
Absolutely. Going back to what I said earlier, we don't think about telehealth as a narrow service for simple things. We think about digital connectivity as touching the entire continuum of care that begins with prevention and goes all the way to catastrophic care and things of that nature. Blending capabilities that exist in big tech, companies like Google and others, combining it with big healthcare, Neuropresbyterian Cleveland Clinic and others, taking into account some great devices like the Apple Watch and many others, and creating a new model of care is going to be existential. It's not going to touch only illness. It's going to touch wellness in a general degree. We tend to think about healthcare as silos, which is a mistake. Sometimes nutrition, fixing my air condition, my heating system is just as important as taking my drug. And by virtualizing healthcare, we're able now to bring into the mix parties that were not involved before and look at the whole person in a new way, because it's possible by still protecting privacy, creating affordability, and things of that nature. Going into the previous topic, we have no choice. Debt is at all-time high. The cost of healthcare is a national security issue, and it's unfair and not working. So there are enough reasons to really get disruptive and to become a little bit uncomfortable by completely and much rapidly being ready to embrace sharp changes in the way that technology and digital connectivity are influencing the future. We will not survive without it. Stephen was talking earlier about, which I totally agree with, about the high likelihood of another pandemic. And by the way, if you think COVID is bad, in theory, the next one could be even worse. So being complacent and agreeing with continuing to doing business as usual is truly not an option. And I hope that in the United States, at least across the aisle, both Republicans and Democrats are going to come together, realize that the threat from viruses may be greater than any type of threat that we see going forward, and invest in fast amendment to the way that we manage our system today.
Well, we've covered a lot of ground in a very short period of time, from the state of the system before COVID, how COVID hit the system, technological transformation in response to it, and whether we've got the right patterns, the election, the impact on drug prices and hospital care. And then I went to you, Ido, thinking that you would give this hopeful vision for the future of preventative care, where digital was helping us understand everything about our bodies, but actually instead you left us with the prospect of needing to prepare for another pandemic.
I need to protest here. I didn't want to mean that. Actually, the conclusion is very positive. I predict that all of us have a future where we and our children, our grandchildren are going to age gracefully in our home. The average quality of care is going to be dramatically better than it is today, both in longevity and in quality of life. There are some real threats.
We've got to wrap up, I'm afraid. But thank you very much for trying to inject a little positivity at the end. Thank you all for taking the time to speak to us, Stephen, Elizabeth, Ido. Thank you so much.
Thank you.
Thank you, Hannah.
Thank you so much, Hannah. And it was great in these difficult times to hear that panel end on an optimistic note about how this pandemic may have changed healthcare for the better. Next up is the future of education. Please stay with us.
It's never personal.
And down they go.
Well, we're almost done. It's time for our final panel of the event, which focuses on another sector upon which the pandemic has wreaked havoc. That's education. All age groups have been affected, from kindergartens right through to universities and further learning. Education establishments have been quick to adapt, but how far can remote learning replace the classroom experience? Are we going to have to get used to completely new systems of education for the long term? And was this perhaps inevitable anyway? The experts joining us to answer these questions and more are Stefania Giannini, Assistant Director General for Education at UNESCO, Jeff Magion-Colder, CEO of Coursera, one of the world's largest e-learning companies, Heather McGowan, a leading education and future of work strategist and author of The Adaptation Advantage, and Stephanie Markin, Executive Director of Education Research at Gallup. The FT's Global Education Editor will moderate, and that is Andrew Jack.
Thanks very much, and welcome to our next discussion, which is on the future of education after COVID and how will online and e-learning continue to evolve. I'm Andrew Jack from the FT, and on our panel today, we've got Jeff Magion-Colder, the Chief Executive of Coursera, Heather McGowan, a future of work strategist, Stephanie Markin, Executive Director of Education Research at Gallup, and Stefania Giannini, an Assistant Director General at UNESCO. So welcome, everyone. Let's begin, if we can, and we'll go in the second half of this panel to audience questions. So I'd invite already anyone who's watching to start posting their questions through the app, and I'll feed those into our conversation. But let's begin with a round thinking a bit about how COVID has disrupted the education sector from your different perspectives. Let's start maybe with Stefania. What are you seeing from UNESCO with your global perspective on schools and higher education around the world?
Well, good afternoon, first of all. Thanks for having me. And I think we can say for sure that this COVID-19 has been a big game changer in many sectors, and education as a public sector has been really very much affected. It's the largest ever disruption in education we had in history, the unprecedented situation. I can recall some numbers. At the peak of the pandemic, April this year, we had some 1.6 billion students from early childhood to university level out of school because of the crisis. And this disruption in education has immediately magnified inequalities, which were already there, raising the risk of major learning losses, which are not yet able to calculate exactly, but we know that because of this huge gap, there will be for sure a risk of what the Secretary General of the UN this summer defined a generational catastrophe. So it's about remedial actions that governments and the education communities put in practice from the beginning of the crisis. And it's about, let me say, to see the positive side of the crisis. Each crisis has always a kind of opportunity behind the corner. And I think that in this case, it's a new kind of international solidarity and partnership that you also experience in the UN system, and a new kind of alliance with the private sector in education. This is very important, new dimension, very, very relevant also in terms of the model of learning we are building on. With our partners, we have conducted surveys in more than 150 countries. That means a real global observatory of this crisis that can provide us a picture of where we stand today. And I should say, to summarize, that building back better, more resilient systems of education, ready to definitely address future shocks, requires target learning support, requires definitely valorizing teachers. We are seeing teachers as the frontline workers in this crisis. You can compare the role of teachers in classrooms as medical doctors in hospitals somehow, to compare these two public sectors very much affected by the COVID-19. And of course, investing in skills and narrowing the digital divide. So I think these four pillars of building back better is about the reaction of the system to this unprecedented situation.
And we'll come back to those points and challenges going forwards in a minute, but let's just go around the rest of the panel. Jeff, obviously Coursera has been in the business of online learning for a long time, but how has COVID changed your model and demand?
You know, as many people say, COVID has really accelerated many of the trends that were already happening. Currently, of course, it's kind of obvious, the trend towards online learning and remote working are both, in full force. And I think in both cases, for education and for work, we will not go back to the way we were before. Not to say that campuses will close, and not to say that offices will never be reopened, but I don't think we're going to go back to a place where everyone who is expected to be learning would be on campus, and everybody who is expected to be working would be in the office. We've seen at Coursera a 400% increase in individuals coming directly to Coursera. Our university partners have authored 4,500 courses. There's very high quality learning that is now available for free online to anyone in the world. A lot of people don't know that 5 years ago, we launched Coursera for Business. This is to help businesses upskill their employees. We've seen 500% increase from businesses. We have Coursera for Government. This is where governments can retrain people who become unemployed or need to change their career trajectories. We've seen a 900% increase in the number of people coming to get educated through government programs. And then finally, we have offered Coursera for Campus. This is for universities who don't have online content that they've created themselves and want to license it. We've seen 5 to 10 times higher enrollments among students. And as Stephanie has said, when 90% of all students in the world have their schools closed, they have to go online. And so many campuses are drawing on existing resources, like Coursera and others, to provide online. So I think online work and online learning will never be the same. And I also agree that this pandemic, although now it is accentuating the digital divide, it is having disparate impact on those already less advantaged. I can see a world where if anyone can learn from the best institutions from anywhere in the world, and if what they learn, if those skills that they learn can be translated into economic opportunity, even if the jobs aren't in their community, they still have access to a global pool of new digital jobs. I think there's real promise that a move towards digital can help create access to learning and create access to economic opportunity as well.
So that could be at least part of the upside. But Stephanie, what are you seeing when you're doing your analysis about these trends?
Yeah, so I mean, obviously we've been disrupted tremendously all over the world. We have been interviewing US adults in particular about their attitudes towards online education, really for the better part of the last 30 or so years. As there have been individual courses who've moved online, and then as online and hybrid options became available in the US, even over the course of the last 15 years, we've been asking people, how interested are they in these online courses? And what's interesting to me as an individual consumer of education, I've done both online and traditional campus-based courses over the course of the last 20 years, is we see a transition in how US adults perceive online education, right? So it used to be 15 to 20 years ago, people assumed online education meant inexpensive and also meant that it was lower quality. And I hope through this experience, this big transition that's happened in the US and around the world, that we've demystified a little bit what online education is, that it's not necessarily lower quality, it's just simply distance. I think in the spring, when the pandemic first set in, we lost a few potential consumers of online education by trying to equate distance learning with online, highly designed and well-designed education. Obviously, there's a significant difference. We saw a lot of professors just simply throw up a Zoom and try to teach the same way they've taught in person. Obviously, that's not possible. So when we look back to some of the spring data that we collected directly from currently enrolled students, we heard a lot of complaints about quality and this perception that online does mean lesser than, when in reality, what we see from our data with programs where they are designed to be instructed online, and I'm sure Jeff has a lot of opinions about this from his perspective, they're actually higher quality, if not the same quality of an in-person experience. We conducted a study about a year ago with graduates of 2U powered programs. And we asked those individuals the extent to which they felt like they were challenged by their curriculum, the extent to which their professors engaged them. These were fully online programs. And we actually found that their ratings on things like quality and engagement and having an engaging professor and being excited about learning, and even on rigor, were actually much higher than the national average, including campus-based programs. So my hope is that through this experience, through this experiment that people have been forced to go through, we demystify a little bit what is online education. It's not just distant learning. That's the easy part, creating the distance. The hard part is creating a curriculum that's really designed to be administered and received online. So my hope is that a lot of institutions that have never had a chance to actually experiment with that or go through that process have learned a lot. I think they have. We interview a lot of currently enrolled students throughout the US, and we ask them things like quality, rigor, relationships with faculty members. And we have seen some improvements from the spring into the fall. I think some are further along than others, but my hope is that we've learned something in this moment about what high quality online learning looks like.
So Heather, picking up on that point, we've obviously seen this kind of rather traditional educational model, which is kind of very much, age-based, school, university, then off into life, haven't we? And that's clearly now, in theory, with digital, there's a lot more scope to fragment that model. Are you seeing, in reality, the sort of past trends beginning to evolve substantially in response to the new COVID era? How is it disrupting those trends?
Well, I think we're in the middle of what I would call a forced social experiment, and there are a lot of upsides to it. I advised university presidents for about a decade, and I spoke to them at the beginning of the pandemic, and they had deans who had told them it would take 18 months to put courses online. They did it in 12 days. So I think a lot of people surprise themselves with how adaptive they are. My only concern is that we are still focusing too many areas on codifying and transferring predetermined skills and existing knowledge, and the world is moving way too fast. So the World Economic Forum just said in the next 4.25 years, almost just 4 years, we're going to need to reskill 50% of our workforce. We're not preparing people for a lifetime of reskilling. We're not setting that expectation. We're still telling people that life's going to exist, education, career, retire, as opposed to what I think it is, which is learn, which is lifelong, leverage, which signals of work and learning are now a combined act, and longevity, because the reality is that we didn't plan for, save for, nor can we have a 30-year retirement. So we need people to be in constant state of learning and unlearning. And I'm not sure that we're setting up that expectation right now. Lots of positives coming out of this. I wish COVID would stop right now for a number of reasons. I mean, it's done all the things it could do that are positive for us. We've proven what we can do. Now to step back and say what works, what doesn't work, when should we work remotely, when should we work in person, what kind of courses and content do we need to rethink, because the way we're doing it is not the best. And, you know, as all the panelists said before me, it has magnified our inequities. Warren Buffett once said, when the tide goes out, we can find out who's swimming naked, and there are far too many of us without clothes on right now. And it should be, I declared it the other day, that human capital era. The SEC just decided that first time since 1977, they made a change requiring human capital be a disclosure, because human capital is the #1 source of value creation. We ought to start thinking about it that way, and not having education be something that's a 30-year life or something that you do when you're out of work, but something that we do lifelong, because it's part of our core infrastructure and a part of our core economy. And we need to make that shift next, because we've left too many Einsteins behind, and income inequality is going to bring our economy to a screeching halt soon. So we have lots of opportunities in this moment to say, okay, what have we learned? What have we learned from what works, what doesn't? What have we learned from folks we're leaving behind? Which, even if it's not a shift from me to we, which I hope it is, it's not good for us to leave human potential behind. It's the human capital era. Let's start acting like it.
And Stefania, I'm sure you'd agree in UNESCO with that whole need for lifelong learning and adaptation to the skills of the 21st century. But do you think that agenda has had to be, or is going to be pushed back somewhat by this focus on rebuilding what's been lost over the last few months? Or is there a way to combine the two?
Yeah, I think that inclusion must be still a key word in this big mission we have within this pandemic, but just looking beyond the pandemic, we hope this time will come soon, to rebuild and to reskill the system of knowledge and the way we learn and we teach. About skills development, I think that, you know, it's a long-term discussion. It's not something that this pandemic brought out. But the way we are doing now, it's, in my opinion, we have a tremendous opportunity to unlock the power and the potential power of changing of technology. Once we take the question of filling the gap and the digital divide, of course. Let me say that education and training systems today need really to better assess and anticipate changing skills needs. And this is in order to adapt programs, to adapt qualifications, to adapt pathways offered by universities and training systems. And I see 4 ways where digitization is impacting the demand for skills and the type of skills in demand. I summarize a bit, if you allow me, like this. First, it's about substitution effect. As technology disruption and automation, we must say, are substituting the capital for labor, leading to unemployment and mobility. So the answer is about a skills development strategy which requires reskilling of large number of workers. And this is something that we are starting to think about. Second point is about what I should define a creation effect, whereby the demand for new goods and services increases and leads to the creation of new occupations. Businesses and even industries which require new skills set, new programs, and certification and delivery modality. The third one is a spillover effect, where new occupations can have a spillover effect on economies, and it's about creating additional jobs. And the last is a kind of augmenting effect, which concerns the possibility of digitalization not to replace jobs, but rather to augment and give more opportunities. So everything is about rethinking the system of learning, not only at university level, but before university. It's a lifelong learner's perspective that the 2030 agenda definitely introduced in the system of education as the real, at the new added value of this century. And we had to take this opportunity of this rapid change in order to unlock the potentiality we have of making the system more resilient, from school systems to higher education.
So let's just keep Jeff on this theme of lifelong education. I mean, obviously, Coursera has been providing lots of courses over the years, which I'm sure do help with reskilling. But is there an age bias? You know, does it tend to be earlier career, younger, or are you seeing an evolution in the sorts of people coming to your resources to reskill later in life as well?
Well, clearly, lifelong learning is going to be with us, and not just because it's good for us and good for society, but because individuals will basically be forced to do this if they want to remain, relevant to the job market. It was interesting in the recent World Economic Forum Future of Jobs report that just came out. They, among other things, asked questions to the companies of what has been the impact of COVID-19 on your business. And 94% of them, probably not surprisingly, said that they're going to accelerate the digitization of work processes. And that's the substitution of capital for labor that's been happening, is now increasing because of COVID. 91%, this is in the UK, said that they're going to provide more opportunities to work remotely. And this is happening globally. Not every company and not every job, but many companies and many jobs, particularly digital jobs, will be available to work remotely, whether that's fully remotely or just not in the office so much. And then 66% of UK companies in the World Economic Forum report said that they were going to accelerate the digitization of upskilling and reskilling. So learning is moving online. What we have at Coursera, and I think this will be the model that will, not to say predominant, and that's not just Coursera, but platform models are very effective at being dynamic, responsive, and delivering wide selection at low cost. And when higher education, top universities in the world author 4,500 courses that could be used by anybody in any combination at any time, suddenly there's a lot of opportunities for adults to be able to say, I need to learn a little bit more business leadership or negotiation or cloud computing or machine learning or data visualization or Tableau or Python or almost anything. And so you've got this wonderful platform where great educators are creating good content. Consumers are coming and finding it, not just individually, but through companies. Companies are sponsoring upskilling programs because it's imperative that companies remain competitive. And if the competitors of a company upskill their folks to learn about software development, cloud computing, IT security, machine learning, and a company doesn't, that will be a really big problem for their future viability. So I actually think that companies will be a driving force in motivating individuals to learn for the rest of their lives. We see, Andrew, the average age going up over time. And when you look at individuals taking degree programs, we have 20 master's and bachelor's degrees that our partners deliver, fully online degree programs, including University of London has a bachelor's in computer science. Imperial College of London has a master's in public health. The average age of students taking degrees on Coursera from our university partners compared to on campus is 10 years older. So there's a whole workforce out there that cannot quit their jobs and move their families back to campus, and they don't need to anymore.
So we're getting a whole bunch of questions in, so I'm keen to start addressing them, and do please continue to post them. But Stephanie, I mean, maybe a first one which links a bit to Jeff's point, I mean, is really about that sense of disruption from traditional educational models. And I see there's a couple of questions here around pricing, and particularly, if we do start to evolve, if we do start to go more online, does that start to undermine the traditional physical provider-based model and put new pressure on pricing for online delivery of knowledge?
I hope it puts pressure on everybody for their delivery of knowledge. I will say, when we interview U.S. adults about their attitudes towards higher education, in the U.S. in particular, what we hear is a lot of excitement and enthusiasm that it is ultimately the pathway to a better job and a better life. So there's universal agreement about that. But if you've been following our trends over the course of the last few years, you'll see a real decline, a sharp decline in confidence in higher education as an institution. People still believe it's the pathway to a better job and a better life, but they're growing impatient with what they view as an inaccessible system. So people believe overwhelmingly, and the data absolutely shows this, that higher education as an institution outside of some non-traditional providers that are really growing is really inaccessible to most Americans, right? The cost, the physical expectation that you be there in person. So the biggest complaints we hear are this system is out of touch and out of reach for most Americans, and in part of that is due to price. So I do think that's a serious issue we have to address in the US and globally. I will say, I do think we have the ability to do that if we're honest about the value that we're providing students. Not every program does provide high value. And we have to, I think, get to back to basics a little bit about the things that do drive out groups that are underrepresented in higher education. And we talked about inclusion on this call already, and I'd be remiss if I didn't acknowledge the fact that there are a lot of students that have been excluded for a very long time in our higher education system. So it's easy to be nostalgic, I think, for a pre-COVID environment, but we kind of have to acknowledge that that system also left out a lot of students. So we have a growing digital divide. We have the challenges and accessibility for students who don't have access to the resources they need to log on. But prior to this moment, we also had an entire group of consumers that were totally left out of the education system due to things like cost. So I think we have to acknowledge that the better path to the quote new normal probably looks like some of what we had in the past, some of what we've added, and some of which we have yet to add, which is bringing down costs and making this more affordable. I mean, the growing rate of individuals that are choosing institutions like Western Governors University in the US, which has record low rates of attendance, tells you what the market will bear. And the market is telling us that that's what they believe a college education should be, and that's what they can afford. So I think to Jeff's earlier point, we've just put an exclamation point on some of the market indicators that were already trending a certain direction. There's a reason that the fast and growing institution in the US, Western Governors University, is growing at the rate at which it is. And a lot of that is due to the accessibility they provide with an online curriculum, a unique one, and one that's really affordable. So I think we have to address costs somehow, because that's not just a COVID issue. That's been an enduring one.
Heather, what do you think about costs and how far existing, particularly universities and colleges, are kind of feeling the pressure to change and adapt, both on pricing, but also on, to your earlier point, kind of catering to lifelong learning? Will they be heavily disrupted?
Yeah, the cost has been way out of whack for a long time. If you look in the US, before COVID, 25% of our universities were in some form of financial distress. So it's going to accelerate the reshaping of those universities. The ones that aren't sustainable aren't going to exist. New ones should emerge. The problem with universities is we have a huge population that needs to reskill, upskill, and that's only going to grow. So the learning business has never been bigger. But if you're in the education degree business on campus, 18 to 22-year-olds, you've been on your way out for a long time. We've talked about the cost divide, the digital divide. I think one of the things we're not talking about is the motivational divide. Marina Gorbis from the Institute of the Future Work says once we close the digital divide, the next one will be the motivational divide. I couldn't agree more. We ask young kids what they want to be when they grow up. It's an absurd question today. World's changing too quickly. We ask university students to pick a major before they step foot on campus and then myopically focus on it, geared towards their first job when they may have 16 or 17 across 5 different industries. We're not teaching them to connect to their internal motivational divide, which is their sense of purpose, curiosity, passion, so that they can fuel that lifelong learning. And we're not giving them the skills to adapt across multiple identities. Multiple studies in the US and the UK have found job loss can take twice as long to recover from, if you do recover at all, to the same level of well-being as the loss of a primary relationship, because it's the loss of your entire identity. We haven't addressed that yet either. So we really need a massive reshaping, and I'm hopeful that COVID is sort of a catalyst to bring more of that reshaping in. We start focusing education on internal motivation. We start seeing that lifelong learning is not adding more of what you know to continue to confirm your existing processes, but is embedded to include unlearning and letting go. My co-author and I'm going to plug for Stefan, wrote the book, The Adaptation Advantage, before COVID, about all of these trends, which have just accelerated. We need people who are driven by their own motivation, lifelong learners, excited about learning. The stuff we do in kindergarten's got to just keep going. We sort of, all the stuff Gallup has found that our students start disengaging after kindergarten through middle school, through high school. It's a straight line down, because we move away from connecting to what they're interested in to telling them what they're good and not good at. It's a zero-sum game, and it's a race to the bottom. we can do much better to tap into human potential and all forms of human potential so we don't have as many lost Einsteins as we do right now. You're better off being born rich than smart right now in the US, and that is a tragedy.
Jeff, I mean, you're a disruptor in many ways, but you're also, of course, working with a lot of established higher education institutions which are trying to keep their existing price points. How do you see that pricing pressure playing out in the coming years?
One of the things I think is really special about this historical experiment that happened back in 2012. I mean, Coursera was started by 2 Stanford professors, and I sometimes think of it as an experiment that escaped the lab. There's 4,500 courses where you can watch 150,000 university lectures for free. The marginal cost of delivery is so low that it changes the economics of access to the content. Now, access to a credential is a little bit different. And I think it's useful to separate the learning and the content from that credential. And often you have to be admitted to a program, and then you have to complete the course of study, and then you get this degree. But what we see with universities is they really have demonstrated that they are willing to put a lot of educational material out into the world at high quality and very low cost, and not just these open courses. The degrees that our partners offer on Coursera are typically about half the price online as what they would have been on campus. And of course, it's largely because the efficiency of delivering online learning can be so much better. To what Heather said, I really agree with this. There's a lot of people who really think that access is the only question, and it is a big question. But this motivational one is important too. In the US, we have Teach for America. They say, don't expect a child to learn until they say 2 things. I want to, and I can. We made huge progress on the access. I think the next big piece is the I want to part. Part of it is having a supportive, inclusive environment. And frankly, part of it is making sure that you can meet learners where they are with the flexibility and even the level of difficulty. So there's many on-ramps, including starting with the university or starting with work experience or starting with military experience to get into a longer-term educational opportunity.
Stefania, you can come back by all means on those points if you like, but I see there's a few questions here around the issue of the things that are lost with online education. Gibran here is saying for younger kids, it's just not the same, the social aspect of interacting with other kids in particular. How can we address that?
Well, I said before, we don't have yet a clear picture of to what extent this 7-8 months of shutdown of school systems all over the world can really become a generational catastrophe. We hope that the socio-emotional dimension of learning can really become the next step in building better resilient system of education. But what you can say already is that also when education systems could rely on e-learning, which definitely, and connectivity, which definitely have become the way to assure continuity of learning, there are some dimensions that has been already affected. I want to mention some of them. One is about girls' education that is very much more at risk of increasing the divide, the gender divide, which is already a big issue in implementing SDG 4, inclusive quality education for all. And we see that the risk of dropping out for girls will be very, very higher than for boys, in specifically in some regions of the world, like the sub-Saharan region, for a kind of cultural, social constraints that, of course, can, as we learn from other crises, sanitary crises like Ebola, can become a real problem. And in terms of the north of the world, we can say that this crisis in education is very much about leveraging technology as a way to assure continuity of learning. But on the other side, we discovered that schools are not simply places to learn. Schools are places where children find the social protection, where children find nutrition, where children find a system of well-being, that when schools are closed, there is a huge gap, which is not easy to fill. So I think that the mission that the international system and the international organizations have now is to support governments to put in practice what we call a hybrid model that can complement the role of technology and e-learning platforms with many other dimensions that can really become relevant ones in the near future, like the teachers training, which can make teachers very well better equipped to move from the traditional classrooms to the virtual ones, and not simply transferring online the traditional way of teaching as it happened from the beginning of the crisis. I think that learning loss is something that will be, unfortunately, for sure, a legacy of this disruptive crisis in education.
Picking up on that, Heather, I see again, there's a few questions here around what Stefania was just saying, the role of hybrid education, because I guess there does seem to be a clear message, doesn't there, that it's not just about a sort of pre-recorded lecture. Online or blended learning has to involve quite a lot of additional support, even if it's remote, by teachers with individual students, doesn't it?
Yeah, it's not just your ability to consume content, a skill, a task, predetermined knowledge, and repeat it or store it. It's your ability to work through frustration. It's your ability to persevere. It's your ability to find new questions. It's ability to do propositional thinking. It's a lot of stuff that sort of happens in and around education. It happens sort of central in things like design thinking and design education, where you're sort of thrust into uncertainty and ambiguity. Increasingly, so much of the work we're going to be doing is going to be in COVID kind of moments where the business model changed, the customer changed, the environment changed, a pandemic hit, where we're all going to have to deal with uncertainty in some way. And we've kind of pulled uncertainty right out of a lot of education. So we haven't had folks deal with that. So that's something that we have to figure out how to build back in. And I don't know if hybrid is the solution or if it gets built into an online curriculum. That's not an area of my expertise, but we certainly have to do that. We have to do more than prepare people to repeat things. We have to prepare people to deal with what's never been dealt with before, because that's going to be a bigger part of our work going forward.
Stephanie, are you picking up in your research this sort of frustration or the need for a kind of hybrid model that links online with in-person and with kind of more personalized contact with teachers?
Yeah, actually, a Strata Education Network study that was conducted early on in COVID had an interesting take on this. They actually asked consumers during and then after, well, after, if there ever is one, COVID, would you prefer to be online, in person, or in a hybrid offering? And about a third of people reported hybrid, a third reported online completely, online only, and then about a third said in person. So I do think that there's a growing interest in that hybrid model. I will say we're talking about hybrid, I think, in terms of mode of delivery, but Heather raises a good point about the actual activities that you embed within the curriculum and whether or not there's some practical application of them. We've been conducting the Gallup Purdue Index, now Gallup Alumni Survey, for more than 5 years. And the single most important and transformative experience that we've identified is an internship in which you were able to apply what you were learning in the classroom. Not just an internship, and there is a serious distinction for those who've had low quality internships. And if you had an internship while you were enrolled in your undergraduate experience, one that did allow you to make that connection between real life and real work and the curriculum you're receiving, you're 2 to 3 times more likely to be engaged in your work upon graduation. You have less time to a good job upon graduation, not just any job. You're also more likely to be thriving in your well-being. You're more likely to donate back to your institution, so that should really pique a lot of interest for those donor offices. And you're also more likely to be a strong advocate. You're more likely to recommend your institution to other prospective students. So, you know, those internships, of all the things we have to change and kind of fix about higher education, of which there is a lot, I think that's a pretty easy lever to pull on of all the things we have to change. You know, students have to have internships that aren't just unpaid and low quality busy work, but paid internships, because that keeps a lot of students out of internships. Most students can't afford to work for free. So they have to be paid, they have to be high quality, and they have to somehow connect back to what they're learning. If we could fix that, I mean, that would be a pretty big rising tide.
Yeah, Jeff, I mean, I hear it a lot. For example, in business schools, there's huge frustration and challenge at the moment from faculty and students in terms of having that experience, practical experience, internships and so on when it's online. But I mean, making this connection, there's a question here from Raphael. He says, well, actually, broadening it to the context of Zoom fatigue, which is real, he says, what creative solutions are being explored to enhance the learner experience and the level of engagement with hybrid learning? How do we embed those two different parts? What does best practice look like?
Well, there's so many factors that we can pull apart here. I like to say that turning on a Zoom camera and lecturing to it is like walking in and videotaping a play and calling it a movie. It's not the same thing. There's a level of engagement, interactivity, application that is available. I mean, Zoom is great for certain parts of synchronous interaction, generally not so good for broadcast. But when we think about, kind of the evolution of online learning and where we're going, I do feel like in the earlier stages of open courses, a lot of it was more theory-based, lecture-based, asynchronous. So you could pause and start the lecture when you want, but it was a bit more knowledge-based. And I like that because knowledge is often more durable than some practical, but sometimes tool-specific skills. At Coursera, what we've been doing is we've taken this library of 4,500 university courses. Many of them have hands-on projects, and we built something called Coursera Labs, where you can actually run any software in a browser without installing it. So suddenly, to Stephanie's point, you can take some knowledge from a course, and often taught by universities, and then you can go and build a project using tools of the trade with relevant data sets and relevant business context that specifically apply that knowledge to a business context. Now, that doesn't necessarily engage the question of social learning, and especially when it comes to soft skills. Things about leading people, communicating, influencing, working through frustrations. I liked Heather's point, not just for yourself, but frustrations with other people and their frustrations with you, like self-awareness and issue resolution. Honestly, that's hard to do by yourself. It's hard to do asynchronously. But University of Illinois has been running their MBA program on Coursera now for 4 years. They have 3,000 students. They use a blend of synchronous and asynchronous, Zoom and other hands-on tools, and they are seeing really high levels of satisfaction because it is a mixture of modalities and tools, application, and the latency is a little bit of a drag. But if you wanted to practice public speaking or negotiations or a job interview over Zoom, I mean, at Coursera, we've hired over 200 people in the last 90 days. All of that happened on Zoom. It's not the best, but you have a lot bigger talent pool that you can go after. There's a lot of things that can be done if the right technology is mixed with it. And I think we're making very good progress in thinking about which skills would be best taught in which kinds of modalities.
So there's 2 or 3 questions here around this sort of the paradox almost of online. Maybe Stefania, I'll come to you first. They're saying in the age of AI and automation, if social and soft skills are the future premium, how do we more effectively foster them online?
Well, I don't see a tension between online and in-presence learning and teaching. I see a tension between traditional learning and teaching and innovative way to either we talk of education or higher education. I think the challenge is the same. I think that many European universities, for instance, Cambridge, just to mention one of the most popular one, are already promoting a new model of hybrid learning where massive lectures are offered online and face-to-face is restricted to activities, to lab-intensive workshops which can maybe prefigure out the system of higher education of the future. And this is a clear example of hybridization, which I think can take into account the interaction and the need of what students, especially undergraduate students, still think it's a very important dimension of higher education university level. That means the campus experience. Higher education it's not a simply transmission of knowledge. Is a part of your growing up time and life. So I think that in higher education, as in education systems, we see in practice a lot of new methodologies and innovation I'm sure can pave the way for a next generation of education systems. And when it comes to graduate education, we have already enough evidence about what I should define an attitudinal change, a real natural change towards online higher education. And in many countries, we are convinced that the students in online higher education will be outnumbering those in traditional campus universities in just a few years, 1 decade. So I think that the main point, just to jump to the question of pricing that you mentioned before, if I may to conclude, is that increasing demand and equity will remain really a foremost challenge as reliance on for-profit providers increases. And this is a big risk to understanding education and higher education as a public service and a common good. I think that the societal mission of higher education has never been more strategic than now for generating, for producing ethical and evidence-based solutions that can really steer our world towards a more sustainable and social and justice. So the role of universities, we have to keep in mind, is to be the main infrastructure for development.
Thanks very much. We're really almost out of time. Heather, just one tiny final word and a question. Are we doing enough to redesign curricula sufficiently? We've talked a lot about modalities, but what about content? Just in 30 seconds, please.
Yeah, no, I don't think we are. I think we're still focused on that codify and transfer model. We have to think about our skills like applications on the phone. We're going to add and delete them across the lifespan. So we need to develop learners who are much more comfortable going into uncertainty, finding the skills they need themselves, learning as a natural extension of their own curiosity and their own motivational divide. As I say, we've got to instill in folks that learning is the new pension. It's how you create your future value every day. ABL, always be learning. And I'll leave it with that.
Learning is the new pension. Well, thanks very much. And I'm sorry we don't have more time, but thank you all to all our participants and thanks for all your questions. Very good session.
Thank you.
Thank you.
Thank you.
Thanks, Andrew, for an outstanding session of particular interest to those of us who have children in school learning in new ways. We are all learning by doing during this pandemic. So here we are at the end of the final day of what's been an exceptional 3-day event. We'd love to hear what you thought of it. And if you fill out our short survey at live.ft.com/feedback/boardroom. Again, that's live.ft.com/feedback/boardroom. You might just win yourself 150 British pounds worth of Amazon vouchers. Now, as many of you may know, if you were with us for days 1 and 2, we usually round up with a recap of the sessions throughout today. Well, as today is the final day of the Global Boardroom, we are going to end things slightly differently. There have been so many fascinating and inspiring moments across the course of this event that we thought we'd close with a video showing a collection of our favorite moments. I'd like to say a huge thank you to all of our partners and to say it's not too late to check out the partner hubs on our website. And can I also remind you one last time of the other key features that will remain on our website for the next 90 days. Knowledge and professional pass holders will be able to rewatch all of the sessions, and the community and networking features will remain open for professional pass holders for the same period. And let's not forget our global gallery and your opportunity to win one of 10 lifetime subscriptions to the FT. My final note of gratitude are to our moderators, our fantastic speakers, our technical teams behind the scenes, and last, but absolutely not least, to you, our audience. You've continually supplied our partners with engaging and provocative questions throughout the event, which has helped to make it such an enormous success. So, all that's left to say is we'll see you on May the 4th, 5th, and 6th next year for our next Global Boardroom. And now, let's take a look at our best bits. Thank you, and goodbye.
We succeed when everyone has a chance to succeed, and that's more important now than ever before.
It's been impressive, the speed at which these vaccines have been developed. So we're looking at several months.
I think at least in Sweden, we calculate with vaccinating to stop the spread of a pandemic, we're talking at least 6, 7, 8 months before we are there.
The Democrats got themselves backed into the corner of we'll put the pandemic first in the sense of protecting lives, and Trump will protect jobs. And that is a bad place to be.
It's hard to imagine going back to days where we would get on an airplane and fly somewhere for one meeting. And it's also meant a lot more collaboration. So I now work with more colleagues from around the world.
Now it's like, look, we all know that this is really chaotic, so you have to be kind of adjusting, not believing too much. We've returned to stability.
Thank you very much for joining us. And I hope we also have the late, great Chicago economist, Milton Friedman. Professor Friedman, Milton, if I may, can you hear us okay back there in 1987?
I am Milton Friedman.
People have learned to navigate COVID in terms of, the economy. We see the economy continue to grow despite a second and maybe a third wave.
It's been a really quite surreal year for Hong Kong. It started with the protest last year, which saw some of the most terrifying scenes that I have ever witnessed. And these scenes were happening right outside Ashurst offices in the heart of the financial center in Hong Kong.
For India to thrive, to have a high rate of growth, we need to have an open economy.
It might be reasonable to expect that in a world where there is a trade deal, there will be a greater degree of cooperation and goodwill.
The key is investment.
Our economy is now 20% less carbon intensive than it was in 2000. And in 2018, the European Union carbon intensity was 20% lower than in the United States and 70% lower than China.
So we had a sharp drop of the GDP in the second quarter, but then what we had was a very strong rebound on the third quarter, above expectations of our national and international analysts.
The murder of George Floyd was in a time when we were all watching and we could better see it and start to feel it in a different way. Speaking as a white man, running a big company and in a position of privilege.
the pandemic has raged, knowing no borders, and frankly, almost knowing no industries either. But I think what's really distinguished the United Arab Emirates to a very large degree has been our agility to cope as quickly as we can.
And I think for these countries, getting back to your pre-crisis level of per capita income is going to be a very slow process.
In the meantime, we will have to live with a two-speed economy across countries, across the world, within countries, and for people.
The economy before the pandemic obviously was very, very strong and had been led by the consumer.
It's amazing that the rate of unemployment didn't increase much, from 2.5% to 3.0%.
Everyone is finding digital ways to be efficient, to be productive. So all of this is a great boost for any kind of startup or tech company involved in providing digitization.
As Abraham Lincoln said, you can fool some of the people some of the time, all of the time, and all of the people some of the time, but you can't fool them all the time.
half. Last quarter, we witnessed the fastest economic growth ever recorded in the history of our country, 33.1%. It's a number that is more than double our highest. That was in 1952, and we've more than doubled it. The United States experienced the smallest economic contraction and the most rapid economic recovery of any major Western nation. We went down less and we went up more, which is quite a combination of facts. While healthy Americans have gone back to work and to school, we continue to spare no expense to protect the elderly and the vulnerable. According to some estimates, a national lockdown costs $50 billion a day and hundreds of thousands of jobs every single day. Ideally, we won't go to a lockdown. I will not go. This administration will not be going to a lockdown. Hopefully, whatever happens in the future, who knows which administration it will be. I guess time will tell. But I can tell you this administration will not go to a lockdown. There won't be necessity. Lockdowns cost lives, and they cost a lot of problems. The cure cannot be, you got to remember, it cannot be worse than the problem itself. And I've said it many times. And when you look at what happens during a lockdown, I just say it very loudly. It's horrible what happens with drugs, alcohol, depression, loss of jobs, business closures. It's a terrible thing. So this administration will not go, under any circumstances, will not go to a lockdown, but will be very vigilant, very careful. We understand the disease. It's a complicated disease, but we understand it very well. We ask all Americans to remain vigilant, especially as the weather gets colder and it becomes more difficult to go outside and to have outside gatherings. And with that, I just want to ask some very talented people to come up and say a few words. General Perna and Dr. Slaoui have been incredible. The general is really getting started right now, but he's really what we don't know and what people don't know. He started putting this all together 6 months ago, and you're going to see some real action. So, General, maybe you'll start it off, and then, Doctor, you'll go right after that. Thank you very much, and then we're going to finish it off with Mike Pence. Okay? Thank you, please. Thank you, sure.
All right, you've been listening to President Donald Trump in the Rose Garden giving an update on Operation Warp Speed. It is his first public speech since his election loss. He did make several comments about where we are when it comes to a race for vaccines, talking specifically about Pfizer. He did make some comments about how Pfizer misrepresented its involvement in Warp Speed. More importantly, though, he moved on to talk about emergency use authorization for that vaccine. He said it will be coming soon. His words, a matter of weeks. He says millions of doses will soon be going out the door. He expects to give the vaccine to health workers, elderly, high-risk individuals, which is certainly something that concurs with what we've heard from so many members of the medical community that we've talked to. Those are the expectations that vaccine will go to the frontline workers as well as those individuals who are at high risk. I think the really key headline to all of this is he said as soon as April, the vaccine will be available for most of the country. It will be broadly available as soon as April. So I thought that was pretty key about that. I do want to be fair. He did say that the U.S. has the lowest mortality rate in the United States. Just looking at some Johns Hopkins data, that is not the case. And this is when we talk about deaths per 1,000 population, 100,000 population. The U.S. is certainly not the worst with that, but we are not the best. Countries like Italy, France, Sweden, Ireland, Costa Rica, Canada, they are doing better than the United States. He did also talk about emergency use declarations, that they do expect to issue those for other drugs in the near future. He then briefly went on to the economy and saying that it is rebounding far beyond any expectations. He did then go back a little bit to the virus, saying that in terms of any kind of lockdowns, again, he said this administration will not go to, under any circumstances, to a lockdown, and then said whatever happens after kind of happens. So he did say that the administration will continue being vigilant, and he did ask Americans to do the same as it gets colder. So again, President Trump from the Rose Garden, his first public speech since his election loss. And as I mentioned, I do think that key takeaway is that as soon as April, the president expecting the vaccine to be available for most of the citizens of the United States. All right, let's get a check on all that's happening when it comes to world and national news. For that, it's over to Denise Pellegrini in our 1130 newsroom. Hey, Denise.
Hey, Carol. Well, as health officials eye April and a possible widespread release of a vaccine for coronavirus, health experts and officials are also warning against having, in the meantime, big Thanksgiving family dinners. And some say don't have anyone over at all as COVID-19 cases surge across the country. Dr. John Coleman is an ICU director at Northwestern Medical Memorial in Chicago.
I don't know how anyone's going to be able to quarantine for 14 days and then get tested and really mitigate all risks.
And the U.S. has broken its own single-day record for new cases 3 days in a row now. 47 states seeing an increase in hospitalizations, 30 seeing a daily increase in deaths. And Dr. Ian Lustbader, clinical professor of medicine at NYU, telling us here on Bloomberg Business Week today, watch for more good news on vaccines from other companies after Pfizer said this week its vaccine was looking to be 90% effective.
I think we're going to see, similar, I'm not sure I can say 90% effectiveness, but certainly high numbers with the other vaccines that are coming along.
And we'll be monitoring it all for you right here on Bloomberg Radio. Meantime, Governor Cuomo convening a 6-state summit this weekend. That's to coordinate policy on COVID cases. New York seeing the highest number of cases since April. Mayor de Blasio warning schools in New York could go all remote again on Monday if levels keep creeping higher. And presidential election results coming in. Joe Biden winning Georgia. President Donald Trump winning North Carolina. That's according to TV network projections. I'm Denise Pellegrini, Global News 24 hours a day. This is Bloomberg.
All right, Denise, thank you so much. You're listening to Bloomberg Business Week. Carol Masser in our Bloomberg Interactive Brokers studio. Yesterday, we had a really inspiring interview. It was with Jake Wood. He's co-founder and CEO at Team Rubicon. It's a global nonprofit that he founded a decade ago. And over that time, about 125,000 Team Rubicon volunteers have responded to the disasters in over 700 communities, and they've raised nearly $250 million for their work. He's also got a book out, Once a Warrior, How One Veteran Found a New Mission Closer to Home. It's all about, really inspiring other veterans who come home without a purpose and helping them to have one. Here's a little snippet from that interview and what inspired him to start the organization.
When Haiti happened, I just felt compelled to help. I felt like I had, after 4 years in the Marine Corps, I felt like I'd had, developed some skills and had some experiences that could help in that situation. And so, we organized a team. We went down to Haiti 4 days after the earthquake. We did some tremendous work while we were down there. And that's really when we discovered that there was this potential to build a new model in disaster response by really tapping into the skills and experiences of military veterans.
And it's interesting, too, because, it's grown tremendously. And you guys have had quite an impact around the globe.
Yeah, I think we have built a model that is really compelling. I think when people hear about the work that we do, the common answer I get is, wow, that seems to make so much sense. I can't believe nobody thought of that before.
Right.
And that's always a good thing to hear when you're an entrepreneur. It's much better than somebody scratching their head and saying, gee, I don't know.
Makes no sense.
That product.
All right, and that was Team Rubicon CEO Jake Wood, founder also of Team Rubicon, talking about how his military experience led him to create a disaster relief organization that's helping in disasters around the globe, but also in the fight against COVID. And you can download that entire conversation, find it at Bloomberg.com, at Apple Podcasts, or wherever you get your podcasts. Really an inspiring conversation. Check out his book, too. It is called Once a Warrior, How One Veteran Found a New Mission Closer to Home. So you are listening to Bloomberg Business Week. We did wrap up the trading week. Just a reminder of how we closed on this Friday. Equity averages just off their highs of the session by the close at 4 p.m. Wall Street time. That meant for the S&P 500 closing at an all-time high for the first time since September 2nd. S&P was up 48 points, or up 1.3%, almost 1.4% for the Friday trade, closing at 35.85. The Dow Jones Industrial Average up 1.4% as well, up 399 points. It finished at 29,479, and the NASDAQ closing out the session at 11,829. It was up 119 points. That was good for a gain of 1%. Well, a busy week, a lot going on, and earlier in the week, in a Bloomberg Live event that actually went live today, it was an event focusing on strengthening economic resiliency and the American worker. I caught up with the president of the Federal Reserve Bank of Philadelphia. We're talking about Pat Harker. He and his team have been focusing on the importance of an equitable workforce recovery, something that can help get at the inequities in our current workforce. He talked about a lot of things. He talked about the election, the economy. Check it out.
President Harker, thank you so much for being with us. Really appreciate it. And we're going to get to some of the amazing work that you and your team at the Philadelphia Fed have been doing when it comes to creating economic resiliency and workers. But before that, I kind of want to just set the scene and the backdrop because we have so many big stories this year. You're in Philadelphia. We know that was in the news a lot because of the election and the race. What I'm curious about is how do you see the election outcome, new leadership potentially, new policies, and what that means for workers in Philadelphia specifically, and what it means for workers around the country, many of which are really struggling right now?
So first, thanks, Carol, for having me on. And without getting into the specifics of the election, I think the message that I take away from this is workers want to, feel like they're valued, and that they're rewarded for their work. And people who haven't made it yet, right? People who want to get into the middle class, they need a ladder up. They need a rung up on the ladder. They feel frustrated. And that's not just in the urban centers. That's true across the country. I think about my district in rural Pennsylvania. They feel the same way. So I think that's the work we're trying to do at the Philly Fed, is to figure out how to accelerate that process to bring more people into the middle class.
And we're going to break it all down. What do you think about, though, in terms of a new administration, in terms of leadership, and in terms of really the meaningful policy discussions that we need to be having when it comes to workers? Because it's amazing, and you and I talked about this a couple of weeks ago, in terms of forgotten workers. It's not just a 2020 thing. It's been around for years.
Right. Exactly. And I think first, I'm looking forward to having policy discussions, right? Deep policy discussion, having a debate. This is the nature of our democracy, having that debate. And I think this is worthy of a serious debate. I think this is one of the most critical problems we have, because if we don't solve this problem, then people lose hope, right? And when they lose hope, lots of bad things happen, whether to their health or to their communities. So we've got to focus on this right now.
So I also want to ask you one other macro. What is the economic backdrop that we're going to be dealing with as workers? One of the things I know we have a lot of conversations in our newsroom is workers are worried. They're either worried about keeping their job or they don't have a job. What's the economic backdrop we're going to be dealing with for the next 6 to 12 months?
So start out quickly. Before the pandemic hit us, we had a strong economy. It wasn't perfect. It wasn't perfect for everyone, but it was strong. This pandemic has shown us a lot of problems that we have, underlying problems we've had in our society, whether they're racial injustice and inequity, or just the fragility of somebody and their family in terms of their well-being. That has now been exacerbated. Plus, it's accelerated trends we already saw with respect to automation and other trends that we saw. So this pandemic, I think, we're not just going to snap right back to the previous economy. I think that's unrealistic. There are people, though, that need to be retrained. This has accelerated, for example, trends in retail, right? We've seen that. I don't think retail is going to come back in the same way. So we're going to have to figure out how to retrain that workforce, and not just to get a different job at the same pay, but ideally at a better job with higher skills.
How worried are you about the U.S. labor force when you think about it overall? Because, you know, what's interesting, I feel like if you go back to when the major auto companies, right, all over Detroit, I mean, you know, working in a Ford plant or a GM plant, that was a great middle-class job. You supported your family well. Those have been gone for a long time, and I feel like now we're going to see another cycle of that hit the American worker.
But it's up to us. I really believe, I'm an optimist. I'm an engineer by training. I'm an optimist. We can solve this problem. This is not some problem that can't be solved. If we put our minds to it and collectively put our minds to it, government, business, nonprofits, we can move this. And this is the work we're doing at the Philly Fed that we can talk about.
Well, so let's talk about creating economic resiliency when it comes to American workers. You guys have a program. It's called the Economic Growth and Mobility Project. And as you said, Pennsylvania, Philadelphia, you reminded me, the poorest large city in the United States. So you guys have really been looking at your backyard in terms of what, again, has been a systemic problem. Tell us about this program and what you're doing.
So it starts from decades of work we've done and a conference, a major conference we do every other year called Reinventing Our Communities, which I really like this conference. It brings together policymakers, academics, philanthropies, business leaders to mix it up to figure out how to come up with practical solutions to solve the problems we face. We then doubled down on that when we put together our Economic Growth and Mobility Project, or what we call EGMP. EGMP has three legs to this stool. How to create a more resilient economy. One is creating good jobs, what we call opportunity occupations, jobs that pay above median wages, i.e. middle-class jobs, where you don't necessarily need a four-year college degree, right? Pathways to success that don't necessarily require a college degree. Second is innovation in skills training. And then third is I broadly characterize it as infrastructure. Housing, transportation, broadband access, you could put healthcare access in that. If you can't get to a job or the job can't get to you, you don't have a job. So you have to solve all three of these things together systemically to make a real difference. That's the work we're doing right now.
Well, that's what, even just that whole idea of infrastructure. You gave us an example when you and I talked, getting ready for this conversation about, there were jobs, but people just couldn't physically get to them.
Yeah, so the EGMP program has research on those three stools. And then we have what we call research and action labs. And these are deep dives into a community on a problem in that community, but we think it's a problem more broadly. People are suffering this all across the country. So the first one we took on was Northeast PA. Northeast PA, the Scranton, Wilkes-Barre, Hazleton area. There were jobs out on the highways. There are logistics jobs, truck repair jobs, et cetera. And by the way, these jobs can be good jobs, like truck repair, diesel mechanics, can make upwards of six figures in these jobs. But the people, low-income people living in, say, the city of Scranton, didn't have cars to get to those jobs, particularly in second and third shift. So we organized a conference. We brought some national experts in, and then we helped organize a group with a local university at the heart of this to help solve that problem. They now have something called NEPA Moves, Northeast PA Moves, and they're solving this problem. They're figuring out how to do this. What I like about this story is Geisinger, the main healthcare system up there, they were all in on this. I mean, they were very supportive. But then they realized, it's not just about jobs. If somebody misses a doctor's appointment, it costs us $70 when they added up the cost. And then they figured out it's worth it to us to help that person get to that doctor appointment. So they created a system where they help people get on transit to get there. And if there's a last mile or miles that need to be closed, they close it with an Uber or a van. That kind of creative thinking is what we need to spread across the country.
It sounds like, too, that public-private partnership, this is an important part of all of this. Is that fair?
Yes, absolutely. Absolutely. And the second one we're doing with respect to our action lab is around workforce development. A major tech company in Philadelphia partnering with the government job training board to create a customized program to train workers that they need. And what's different about this, and we think this is the first of its kind in the U.S., is that firm is then reimbursing the government entity for every successful hire, success being successful on the job for several months. That's never really happened before. Here's a true public-private partnership where it's not just in words, it's in action and putting money on the table to help accelerate this process.
How did COVID impact all of this? Because I think about pre-COVID, we were looking at a really strong labor force. We didn't have enough workers out there. Yeah. So how has COVID exacerbated this situation? What kind of setback has been, given to American workers as a result of it?
So as I said earlier, this tragic pandemic we're living through has accelerated trends we already saw in trade. right? So automation being one of those. And we know those jobs that are being automated are often jobs held by low-income people, by women, and by underrepresented minorities. Our research documents that, and there's others who have documented that as well. So that's just made the situation worse for people who are fragile. I mean, their situation economically is very fragile. And so here is where we really need to focus on retraining those people into different jobs as quickly as we can. And there are jobs for them. I mean, one of the studies that we did, which I'm really excited about, our economists and the economists at Cleveland Fed looked at the following situation. They said, take a low-skilled job that may be going away because of automation or because of the pandemic, say travel and tourism or hospitality. Map that skill set that they have, like a sales skill set they can sell, to a higher paying job. And what's the skill set that you need, the training that you need to do that? They looked at 33 metro areas across the U.S., and roughly half the jobs they could match from one skill set to a higher skill set with an average increase in salary, annual salary of $15,000, a 49% increase in salary. So this is real. That's the opportunity if we just work together to make this happen.
And collaboration, that's a way to get things done. And we certainly are seeing that when it comes to the race for a vaccine. That, of course, was the president of the Federal Reserve Bank of Philadelphia, Pat Harker. I caught up with him today. Well, it came out today in a Bloomberg Live event, really talking about how do we create an equitable workforce recovery. There's, again, if you missed any of it, check out our Bloomberg Business Week radio show on the weekend. And you can also check out our podcast at Bloomberg. Check out our Bloomberg Business Week podcast, I should say, and also you can find it on Apple Podcasts. Just watching some of the other headlines that are coming out of that Rose Garden update on Operation Warp Speed. Vice President Mike Pence now making some comments, but among the headlines following President Trump's statements about the vaccine, he did other official saying Moderna vaccine data could come out next week. Also, that the vaccines could be in use by December if approved by the FDA, and that Pfizer Moderna could file for those emergency use authorizations in the next few weeks. And Regeneron antibody could get emergency use authorization in the next few weeks. So we'll continue to monitor those headlines that are coming out of that Operation Warp Speed update. You're listening to Bloomberg Radio.